Good morning, everyone. It's a pleasure to be here today. So as we all know, the economic, environmental and social challenges in the Western Pacific region has presented many health challenges related to non-communicable diseases, ageing populations, climate change and threats to health security. My presentation today will focus on how medical journals can contribute towards creating an enabling environment for researchers within the region to develop tailored evidence-based programs and policies fundamental to address these challenges. First, a brief background about the Lancet Group. As you all may know, the Lancet was founded in 1823 and now includes 24 journals, with the Lancet Regional Health Journals among the most recently launched. The ultimate goal of the regional health journals is to improve health outcomes by advocating for equal access to quality healthcare and advancing research, clinical practice, and health policy in all regions of the world. A large publishing group with an international team of more than 200 professionals located on almost every continent. We have 4 main offices in London, Beijing, New York, and Munich, with our London office being the largest. And for the Lancet Group, advancing equity, diversity, and inclusion is a commitment to health for all. We strongly believe that medical journals have a responsibility to advocate for underrepresented groups and challenge biased, exclusionary systems in research, academic publishing, and clinical practice. The Lancet Regional Health Western Pacific, the first journal in a suite of open access general medical journals based on the 6 WHO-defined regions, was launched in August 2020. The journal is led by Dr. Jia Kai, whose background is in biochemistry, and she's based in Beijing. There are 2 senior editors, Zhifang Huang, whose background is in immunology, and she's based in Shanghai. And finally, Zi Yang, who is trained as a rheumatologist, is based in Hong Kong. So as we've heard previously in presentations, in every country in the region, the prevalence of many non-communicable diseases is increasing, especially cardiovascular disease, cancers, chronic respiratory conditions, diabetes, and mental health disorders. These diseases are becoming more prevalent due to many factors, such as rapidly aging populations, urbanization, and lifestyle changes. Older people are the fastest growing age group in the region. Many older people are living with chronic conditions. For example, South Korea has one of the fastest aging populations and lowest birth rate in the world, and is en route to becoming a so-called super age society by 2025, whereby the proportion of people aged 65 years and over will reach 20% of the total population. By 2050, this proportion is anticipated to increase to as high as 44%. And again, as already highlighted in earlier presentations, climate change poses many risks to physical and mental health. Heat stress is the leading cause of weather-related mortality and can make worse underlying conditions such as cardiovascular disease, diabetes, mental health, and asthma. Extreme weather events is associated with increased prevalence of malaria, dengue, and other vector-borne diseases, as well as waterborne and foodborne diseases. Direct exposure to extreme weather events and forced migration and displacement affects access to basic necessities essential for good health, as well as people's mental well-being. Furthermore, extreme weather events can disrupt health service delivery, which is particularly detrimental in the Pacific Island countries and territories where health infrastructure is located near coastlines. Lastly, the region continually faces health security health security threats, which can lead to longer-term social, political, economic vulnerability. The rise in antimicrobial resistance is a major threat to public health, whereby drug resistance makes it more difficult to treat infections and increases the risk of disease spread, severe illness, disability, and death. For example, based on data from the Global Antimicrobial Resistance Burden Study, bacterial antimicrobial resistance was associated with 600,000 deaths per year in China in 2019. In the region, more than 125 million people become sick due to unsafe food. Of those who fall ill, an estimated 40 million are children under the age of 5. More research is also needed to understand how these challenges affect underserved groups, such as minority ethnic groups, children, pregnant and lactating women, and the elderly. In many countries in the region, a limited evidence base or inadequate health research capacity hinders well-informed health policy. Available findings from bibliometric analysis have showed that publications tend to be from high-income countries in the region. Furthermore, research topics examined do not necessarily align with the evolving research landscape. For example, in this study by Lisa Ham and colleagues on eye health and services in the Pacific, showed that out of 180 studies, the most commonly examined condition was diabetic retinopathy, which does not reflect the leading cause of blindness. Specifically, research about cataract and glaucoma were not found to increase in the last 3 decades. Research needs to take into account also specific biopsychosocial factors contributing to health and illness, given the region's diversity with respect to culture, socio-political histories, demography, geography, economy, and health status. As medical journals, we can help promote the development of standards for good research practice. We can further engage with researchers to understand the main problems they face and help develop practical ways to help them in their publishing. This could be via individual work with authors, or conducting author workshops on planning and writing research, or even peer reviewing seminars. For example, in March this year at Selangor in Malaysia, GIA attended a consultation meeting organised by the National Institute of Health of Malaysia and the WHO Western Pacific Regional Office to discuss priorities and action plans to strengthen clinical trials in the region. At the meeting, more focus towards local ownership and meaningful partnerships was highlighted to prioritise strengthening research capacity in the region. In particular, equity must be prioritised via more efforts to engage local stakeholders, especially from underrepresented populations, to reflect their research priorities in the design and conduct of trials and ensure that they benefit from the research. Limited opportunities to access research training, collaborations, provide research supervision, contribute to writing research papers, and take part in peer review are major obstacles for researchers, especially from those in lower middle income countries. This is a critical issue because these are also fundamental components of research funding applications. As medical editors, we can help promote authorship and peer reviewer diversity in the papers we publish and commission, and also through our editorial workflows. For example, by encouraging invited reviewers to include other researchers, such as PhD students, as part of their research training. Our editorial workflow also includes evaluation of submissions in light of each country's research capacity. For example, the journal collaborated with the WHO on the Western Pacific Innovation Challenge, which aimed to identify researchers to help create an ecosystem of innovators who have sustainable, cost-effective, and inclusive solutions that can address the health needs of the region. All participants in the challenge became members of the Western Pacific Public Innovation Ecosystem, and the winning organisations shared their views on ways of solving public health challenges during the 2022 Western Pacific Innovation Forum, and were invited to contribute their views to be published in the journal. Medical journals we can also contribute to promoting the best available health research evidence to facilitate informed health policy decisions. We can advocate for contextualization of research by facilitating the use of relevant tools such as ecological frameworks, implementation research frameworks, and health system indicators in our workflows. For example, as part of our editorial workflow on commissioned content, relevant frameworks for presenting and interpreting results are often directly discussed with authors. For example, a review on surgical planning in the context of climate change by Rennie Chin and colleagues, based on the WHO Health System Building Blocks framework, discussed how the carbon footprint of theatres could be reduced by maximising equipment longevity, improving energy efficiency, and renewable energy use in the region. Therefore, they concluded that sustainability should be a key performance indicator for surgical system planning. The authors also assessed surgical care capacity of 5 Pacific Island countries and territories to inform the development of the national surgical obstetric and anaesthesia plans in collaboration with the ministries of health in each country. It was found that whilst limited workforce was the main challenge in Tonga, Palau and Cook Islands, inadequate infrastructure was the main barrier in Fiji and Vanuatu. This study highlighted the importance of cross-country regional comparisons to identify health system strengths and limitations to aid policy making. So in conclusion, the region faces many health challenges which we've all heard about during this conference, particularly increased non-communicable disease prevalence, climate change, impacts on human health, as well as health security threats. In partnership with researchers in the region, medical journals have an important role in helping strengthen research capabilities via editorial workflows and facilitating evidence for local health problems and promoting local problem-solving capacity. Ultimately, this will help promote the creation of high-quality research that meet the health needs of the communities we serve. Thank you very much for your time. I'd just like to give a special thanks to my LCV colleagues and the Asia Pacific Association of Medical Journal Editors, conference organisers, for the opportunity to present today.